good morning. Welcome to Nursing Manthra. I hope all you are keeping well. Today I wish to take the class related to the respiratory system continuation. I hope all you are following me. For those who are studying for the PROMETRIC exams, just keep on watching the updated videos. Please subscribe to get the updated videos. So tracheostomy care. What are the interventions for tracheostomy? So that means after the tracheostomy, what are the interventions? So first we have to monitor the breath sound. Any abnormal breath sound is there, we have to monitor. We have to check for the ABG values and monitor for the pulse oximetry. Then we have to provide semi-Fowler's or high Fowler's position those who are in tracheostomy. And we have to give the suctioning if it is required due to more secretion is there, means you can give the suctioning and hyperventilate before suctioning. That is important thing. Okay, so usually they are asking the question like hyperventilation before suctioning. Then suction for less than 10 seconds only you have to suction. That also time they will be asking what is the time period for the suctioning for a patient or those who are in tracheostomy care. Then assess stoma and care. That means assess the tracheostomy stoma and we have to clean the surrounding area with the hydrogen peroxide. It's a half strength hydrogen peroxide. We can clean the area, or plain saline. We just clean and dry it and secure the tubings. And although you know already you are giving the care for a tracheostomy patient, so you can give the stoma care to the patient and by using hydrogen peroxide half strength or cleansing the stoma. So other thing is main important thing is what are the complications for a patient who is in tracheostomy. So the main first complication is tracheomalacia. That means the constant pressure exerted by the cuff causes bronchial dilation and erosion of the cartilage. Okay, due to the more constant pressure, there will be bronchial dilation will be there and erosion of the cartilage also will be happening here in tracheomalacia. Stenosis means narrowing. Okay, so the tracheal lumen will be narrowing and as a result of the scar formation. So what is the management we can give? Management means we have to dilate the trachea. Okay, we are giving the tracheal dilation and there will be shortness of breath for the patient. We have to provide additional oxygen supplementation, everything. And furthermore, the tracheoesophageal fistula will be there as a complication of the tracheostomy. In the fistula, we have 3 C's. That means there will be choking, then coughing and cyanosis. So while ingesting the food, the patient develops the choking, coughing and cyanosis. Then another important complication is the dislodgement of the tracheostomy tube. If the tracheostomy tube is dislodged, we have to grasp the retention sutures and spread it open. Okay, so for first 72 hours manually we have to ventilate the patient. Then after that, if it is possible, if nearby doctor is there, so they have to reinsert the new tracheostomy tube. These are the care for the patient, those who are in tracheostomy tubes. Okay, only this much they can ask. The main question they are asking regarding the timings of this suctioning. Before suctioning, hyperventilation, we have to hyperventilate the patient and the suctioning also. These are the main topics which they are asking for the tracheostomy care. And sometimes can you describe the complication of the tracheostomy also they can ask the names. You have to learn the names of the complications. Okay, I hope you understood the today's this topic tracheostomy care. So we will move to the ET tube care. Okay, thank you. So now we will move through the next topic, that is endotracheal tube care. So endotracheal tube, we know that we have 2 types like orotracheal tube and nasotracheal tube. So orotracheal tube, what is the indication? So when there is any problem in the nasal cavity or any nasal obstructions, or in some patients when we are trying, it will lead to the epistaxis. These clients we can keep the orotracheal tube. And the nasotracheal tube main contraindication is the patient who is having the bleeding disorders. Then what is the care interventions? The patient who is in ET tube. So how we can confirm the ET tube placement? That is by chest X-ray. That is an important question. You will be getting the options like whether it is chest X-ray or auscultating the lung sounds, all those things. Auscultating the lung sound is not the confirmatory test, but the problem is if we are auscultating, sometimes we can misinterpret the sounds. It is in the lungs like that. So the confirmatory test is chest X-ray only. But apart from that, we have to auscultate the lung sounds and the abdominal sound also. The lung sounds, we have to hear the bilateral lung sounds equally. And sometimes we can hear only in the right side part, that means it is in the right bronchus. And when we are checking the sounds in the abdominal cavity, if the sound is there, more hyper sound is there, that is indicating like ET tube is in the abdominal cavity, that means inflated in the abdominal cavity. So it is in the esophageal area. So we can see in the stomach inflation or the size will be increasing, and the hyper sound also will be there in the esophageal area or in the upper stomach. So we have to auscultate for those sounds, and the tube placement, usually the tube placement we are keeping in the 1 to 2 centimeter above the carina. I think that all of you know regarding the carina. And always when the tube is there, we have to keep the ambu bag at bedside after putting the tube. So another important care is we have to monitor the cuff pressure every 8 hours, and it should not exceed 20 mm Hg. Then ET tube, we have two techniques like ET tube occlusive technique and minimal leak technique. What is it? Minimal leak technique. It is used for the cuff inflation and check cuff pressure without pressure relief valves. And there is a slight air leak on the peak inspiration is present and can be heard. Client cannot make any verbal sounds and no air is felt coming out of the client's mouth in this minimal leak technique. And another technique is ET tube occlusive technique. That is, we have to inflate the cuff until no air sounds are present for mechanical ventilation patients. Then another thing is the under care is we have to change the oral tube daily in the morning. When we are giving the morning care, we have to change it to the opposite side of the mouth to prevent the pressure and necrosis on the same side, the lips. So we have to change the tubes, and it will help for the easy clearing of the airway secretions and the mouth care, and it will help you, and it will prevent the nerve damage also. So that is important thing. And how this is regarding the care when the patient is on ET tube, and we have to provide the suctioning. That means whenever necessary, we have to provide the suctioning, ET tube suctioning and all. So before suctioning, we have to hyperoxygenate. All those things you know, that suctioning it should not be more than 10 seconds and all. Same like tracheostomy almost. And you have to keep ambu-bag at the bedside always like that. Then ET tube extubation. So ET tube extubation, how we are doing means, what is the procedure means, we have to hyperoxygenate before ET tube extubation, and we have to suction the oral cavity also. What is the position we are giving to a patient? The position is a semi-fowler's position. Okay. So first, what is the procedure means, we have to deflate the cuff by keeping the syringe. We are removing the air while we are using for the inflation, like that air you have to deflate it. You have to deflate the cuff, then ask the client to inhale at the peak inspiration and remove the suction remove the tube and suction the airway while pulling the tube out. Then after removal, we have to encourage the client for deep breathing and coughing, and tell the patient there will be hoarseness and sore throat will be there after the procedure, that is normal, and advise him to limit the visitors talking and all. So this is the care for the ET tube extubation, ET tube intubation, extubation, all those things. Okay, I hope you all understood regarding ET tube care. Thank you. Today we discussed regarding the ET tube care and tracheostomy care. If you have any doubt related to these topics, you can just comment in the comment box. The questions which is asked from these topics, it will be available in Nursing Manthra books. If you want to know more about these books, you can just comment in the comment box, or you can just email me asktonursingmanthra@gmail.com, or you can contact me through WhatsApp. So our next class is related to the respiratory system only. The conditions are pneumonia, COPD and the respiratory therapies. To get updated videos, please subscribe my channel Nursing Manthra. Thank you.